Hi guys, Dr. Paul Hodgson here, owner of New Wave Stress and Pain Relief, and I wanted to talk to you guys about disc bulges, disc herniations, protrusions, disc injuries in general. Sciatica is oftentimes a side effect of a disc injury. So most people kind of know who have a disc injury have gotten online and they've kind of looked it up, but everyone's in different places in terms of getting the correct diagnosis. And getting the correct diagnosis is a big piece of what's going on. But essentially what happens here is many times we get a bulging out of the jelly center part of the disc through the annular rings or the fibrous outer part. And if that jelly center squishes out on a nerve, that can be big time pain and big time problems, big time dysfunction. So when a patient has this going on, there's oftentimes very severe symptoms going on. Many times these patients have been in the ER, maybe the ER multiple times, maybe they've been sitting in orthopedic surgical consultations. So this is a very stressed out patient. It's usually a patient that hasn't slept in several days, maybe even several weeks, and so it's starting to get very difficult for them to make the right decisions. Now what we offer is a non-surgical spinal decompression. So a surgical spinal decompression is where they're going to go out and actually take the physical structures off of the nerve, and they're going to try to stabilize the area surgically as much as they can oftentimes. This, depending on the surgery and the surgeon and your age and a number of other factors, this doesn't have as high of a success rate as we would like. And we all know someone who's had a terrible surgery, back surgery gone wrong, and they wouldn't recommend it to anyone and they wish they never got it done. But when you're in that moment, you don't feel like you have a lot of options and you don't feel like you have a lot of choices. We have an over 90% success rate with keeping people out of surgery. I think that's pretty good odds. These are diagnosed as surgical candidates, and we're about a 91% success rate with keeping them out of surgery. I don't fault the people who went to surgery afterwards, but my true belief is that we could have got results with them too if they just could have stuck with it a little longer. But I know how much pain they're in. I work with these patients every single day, and I don't judge them for going and getting the surgery, because there's a point when we all have a breaking point. So part of what we do is we're helping hold your hand and get you through the emotional stress of what's going on. Non-surgical spinal decompression is kind of a big catchword, and we have the most advanced piece of technology on the planet for that. That's the Accuspina IDD therapy table. I've worked with several different tables in the decompression space, and this is by far the best. What makes our table unique and IDD therapy unique, it is a trademarked, patented form of therapy. No one else can claim to do IDD therapy because no one else does what our table does. So every decompression will create some sort of axial pull, which pulls the bones apart and creates a negative pressure, which can suck disc material back in, creating more space and more room for the nerves as they exit. Some tables also are able to target specific discs, and I've worked with the #2 table in the world for several years, but now we work with the #1 table in the world, and the difference that I saw between those two tables I really like. I noticed the results tend to come a few visits faster. The results tend to be just a little bit better, a little bit longer lasting. So what makes our table unique is that at the maximum point of pull, we get a pulsing of the pull. So what we're trying to accomplish with this treatment is a rehydration of the disc in addition to a reduction of any kind of bulge or herniation. So the rehydration of the disc though is restoring the long-term health of the disc. So this is why IDD therapy is so critical, so important, and why I'm so passionate about sharing it. I'm really proud that we're able to bring this to Hendersonville. We've got a big time treatment in a small town.